Botulinum toxin, also known as Xeomin Vial, is a medication used to treat various medical conditions. This includes eye disorders such as crossed eyes and uncontrolled blinking, muscle stiffness or spasms, movement disorders, and reducing the appearance of wrinkles. It can also help prevent frequent migraines and reduce symptoms of overactive bladder, severe underarm sweating, and excessive drooling. The medication works by relaxing muscles and blocking the release of certain chemicals. It's important to note that Xeomin Vial is not a cure, and symptoms may gradually return as the medication wears off. The dosage and timing for taking this medication should be determined by your doctor based on your specific condition and medical history. Before using Xeomin Vial, make sure to read the medication guide and patient information leaflet provided by your pharmacist. This medication is given by injection into the affected muscles by a healthcare professional. It is used to treat eye disorders, muscle stiffness/spasms, wrinkles, migraines, excessive sweating, drooling/excess saliva, and overactive bladder. The dose, number of injections, site of injections, and frequency will be determined by your condition and response to therapy. For children, the dose is also based on weight. Most people start to see an effect within a few days to 2 weeks, and the effect usually lasts 3 to 6 months. When using Xeomin Vial, you may experience side effects at the injection site, including redness, bruising, and pain. If you are using it to relax muscles, you may also experience dizziness, difficulty swallowing, and respiratory infections. Double vision, drooping eyelids, and eye irritation are also common side effects. If any of these effects persist or worsen, contact your doctor. Additionally, if you experience a serious allergic reaction such as swelling or trouble breathing, seek medical help immediately. It's important to remember that the benefits of this medication outweigh the risk of side effects for most people. If you notice any other effects not listed here, contact your doctor. This medication, Xeomin Vial, can potentially spread to other parts of the body after being injected, which could lead to serious, and possibly fatal, side effects. These side effects could happen hours or even weeks after the injection. However, the likelihood of experiencing such serious side effects when using this medication for migraines or skin conditions like wrinkles, eye spasm, or excessive sweating is very low. Children being treated for muscle stiffness or spasms are at the highest risk of experiencing these effects, as well as individuals with certain medical conditions. Refer to the precautions section for more details. It's important to discuss the potential risks and benefits of using this medication with your doctor. If you experience any of the following very serious side effects, seek medical help immediately: chest pain, difficulty breathing, excessive muscle weakness, irregular heartbeat, severe difficulty swallowing or speaking, or loss of bladder control. These are all important considerations to keep in mind when using Xeomin Vial. Additionally, it's important to follow the recommended dosage and timing for the best results. Before using Xeomin Vial, make sure to inform your doctor about any allergies you may have or any other medications you are taking. It's important to discuss your medical history with your doctor, especially if you have any issues with bleeding, eye problems, heart disease, diabetes, or any muscle or nerve disorders. This medication may cause muscle weakness, droopy eyelids, or blurred vision, so it's important to avoid activities that require alertness or clear vision until you know how this medication affects you. It's also important to limit alcoholic beverages while using Xeomin Vial. If you are having surgery, make sure to inform your doctor about all the medications you are taking. Older adults and children may be more sensitive to the side effects of this drug, so it's important to discuss the risks and benefits with your doctor. If you are pregnant or breastfeeding, make sure to discuss the risks and benefits of using this medication with your doctor. When taking Xeomin Vial, it's important to be aware of potential drug interactions. Certain medications can affect how Xeomin Vial works or increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. It's essential not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Xeomin Vial include certain antibiotics, anticoagulants, Alzheimer's disease drugs, myasthenia gravis drugs, and quinidine. Be sure to discuss with your doctor or pharmacist if you are taking any of these medications. If someone has taken too much Xeomin Vial and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. An antitoxin is available, but it needs to be administered before symptoms of overdose show up. These symptoms may include serious muscle weakness, breathing problems, and paralysis. It's crucial to seek help right away if you or someone else has overdosed on Xeomin Vial. Before using Xeomin Vial, it is important to understand the potential risks and benefits of this therapy. Make sure to discuss any questions or concerns with your healthcare professional to ensure that this medication is the right choice for you. Xeomin Vial is used to treat certain types of muscle stiffness and spasms, as well as to reduce the appearance of wrinkles. It can also be used to prevent chronic migraine headaches in adults. The dosage and frequency of Xeomin Vial will be determined by your doctor based on your medical condition and response to treatment. It is important to follow your doctor's instructions carefully. Xeomin Vial is typically injected into the affected muscles, and the effects usually start within a few days and can last for several months. It is important to discuss the optimal timing for your injections with your doctor. You will receive Xeomin Vial at a hospital or clinic, and you won't need to store it at home. This medication is used to treat cervical dystonia, blepharospasm, and certain muscle conditions. Your healthcare provider will determine the correct dosage and schedule for your specific condition. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.